Hello, welcome to this month's board update within 10 minutes. This month's meeting focused on items which included intensive and assertive outreach review, the future shift, and building healthier communities by working with anchor institutions. But first, over 90 people from across West Suffolk have used the new Essex and Suffolk Elective Orthopaedic Centre in Colchester since it was launched last year. The ICB and Healthwatch Suffolk have been conducting a public engagement exercise which sought views about the impact the move to the new centre would have on people across West Suffolk. The key issue of concern related to transport and getting to the new centre. Here's the Director of West Suffolk Alliance, Peter Whiteman.
Transport hasn't been an issue we haven't been able to resolve with patients so far under those arrangements, but what we've agreed to do is to keep it under close monitoring for the next 6 months and then to reflect on if there's any difficulties for patients with regards to access at that point in time. Remembering at the moment patients have that choice to go to the local West Suffolk Trust for their orthopaedic surgery as well as the Colchester based surgical centre.
Next, Ed Garrett gave his Chief Executive's update. He's been thanking all frontline staff for their kindness and compassion during a very busy winter period. He says the ICB will be looking to run a lessons learned review. This year's winter saw a significant surge in cases of flu. Ed says increasing rates of vaccination will be a focus for next year.
One of the things I've talked about in the media is around the flu vaccination rates. We saw a significant surge in flu earlier than we normally do. And our vaccination rates for both our staff and for our eligible community were lower than we would have planned for. So we need to think about the lessons we learned during the COVID vaccination programme.
Ed also spoke about the launch of our sustainability review. This is a 4-month assessment into our acute and community services. It was launched because of significant operational, workforce and financial pressures locally. The review will consider how we will be able to increase efficiency and improve our financial standing. Leaders say service integration is another reason why we're undertaking the review. An update will go back to the board later in the year. The Newmarket Community Diagnostics Centre has opened. It's the second CDC within our system area. The facility will allow easier access to diagnostic testing, as well as allow patients faster access to a wide range of tests such as MRI, CT and X-ray. A third site's being pursued in East Suffolk. Ed says he's delighted that the new West Suffolk Hospital is being prioritised. Building work is due to start in the 27-28 financial year. Our Priority Access Scheme for Dental has treated over 8,500 patients since April. Ed says our work in schools is also helping to increase awareness of oral health. Ed's been reiterating his determination to find a Plan B for the Cardinal practice in North Ipswich. The scheme, originally planned on the site of the former Tooks Bakery, was shelved after building costs became too expensive. The first cut of the staff survey has been shared with the ICB. Ed says we benchmark very well against other similar organisations. Full results will be made available later in the year. The first National Diabetes Experience Survey has been published, and SNE is top in the country for experiences of diabetes services. Ed says he's very encouraged with the findings. The director of Ipswich and East Suffolk Alliance says her team's been very fortunate to be working with a number of different organisations whose work is firmly rooted within the local area, known as anchor institutions. Maddie Baker-Woods has been referring to the Alliance's work with the Port of Felixstowe and local military bases. But it was the work with Ipswich Town Foundation that board members got an insight about this month. Dan Palfrey from the Ipswich Town Foundation's been telling the board about Active Blues,
which is a 12-week health and lifestyle programme with an emphasis on hypertension and cardiovascular disease. It's the first programme that we've developed in partnership with the Integrated Care Board. We have around 12 participants per cohort, and these come to us through a combination of GP referrals and self-referrals. Important to add on top of this that we have local GP oversight across the duration of the programme.
Colleagues from NSFT and EPUT spoke about the intensive and assertive outreach review. The review, which systems around the country are undertaking, follows the deaths of university students Barnaby Webber and Grace O'Malley Kumar and school caretaker Ian Coates by Valdo Kalakani in Nottingham. Kalakani had been diagnosed with paranoid schizophrenia, refused to take his medication and was experiencing ongoing persistent symptoms of psychosis at the time of the attack. The government's called on all systems to conduct local reviews to ensure appropriate intensive and assertive mental health care and treatment is available to meet the needs of people with severe mental health illness. Mark Travella is from EPUT.
What the team have done is they've made sure they know who this cohort are and are they being looked after as well as can be reasonably expected without the fidelity model. And I would say that North Essex team who have put all that work into it, I've actually seen what the work they've produced. I would think that they have done that.
A lot of work has been done with the clinical teams around all of the contexts we've just talked through. So where they've identified individuals who fit with this cohort, there's an absolute review of their care plans, their risk assessments to make sure they're as good and as tight as they possibly can be.
And new guidance is expected to be issued in March for the provision of quality safe care across community mental health services. Now, the ICP Director, Susanna Howard's been giving board members a high-level overview of Future Shift. The strategy sets out how the system could improve services and to use untapped potential and new opportunities within the system. Commenting on the strategy, Ed says, with no new money expected, it would be important for local leaders to bring about the necessary change. The Deputy Chief Executive and Director of Strategy and Transformation, Richard Watson's been updating the board about key performance standards taken from the Integrated Care Performance Report. He says urgent and emergency care has seen a level 3 regional response by NHS England to the pressures, which was stepped up in September and down again in December. Richard's also been telling members that occupancy rates within acute and community settings were also high and that ambulance delays remain a challenge. He says 5 of the 8 operational priorities in relation to mental health continue to be met. The Director of Finance, Howard Martin's been giving an overview of the system's financial position. He says the position at West Suffolk NHS Foundation Trust remains the most significant financial risk for this and for next year. It currently has a year-to-date deficit of £20 million. A recovery plan is in place and the Trust remains committed to returning to break-even. Howard also gave an update on what next year may look like.
The next financial year is going to be very challenging and to an extent will feel like a real terms funding reduction after provision for conclusion of pay award decisions and increases in minimum wage. We also know that there will be a clear national focus on delivering a balanced financial position, patient safety, maintaining the mental health investment standard and also reductions in elective waiting lists.
The board's been responding to Essex County Council's air strategy. The blueprint aims to improve the quality of air across the county. SNEF's Chief Executive Nick Hume says he supports the plan.
I'm reminded that 5% of all journeys that happen in the country are to or from NHS appointments. Yeah. So if we reduced, for example, the need for people to travel to points it fits with the shift work, say for example accessing results. I had the bizarre situation of leaving work on Friday evening to go to visit my GP to have blood taken that was then going to be sent back to the place I just left. Now that's a fairly unique situation for me, but it just strikes me that how often are we bringing people to outpatients to tell them their results are all fine. For example, it could be done virtually, so it is around 5% of every journey that happens in the country is to or from an NHS appointment.
And don't forget, the next board meeting will be taking place on Tuesday the 25th of March at Thurston, starting at 9 o'clock. For more information and to look at the recording of this month's board, please visit the events page on the ICB website.